going from a situation of being flush with money, with international funding, when we were working with Johns Hopkins, to starting IRD from, again, a group of 5, 6 people based in the middle of Liari, was character defining because it humbled you to think that, you know, success is never guaranteed in life. Look, we built a not-for-profit, we built a for-profit company, we built a social enterprise, and we did it all here in Pakistan on a Pakistani passport with no second nationality, at least for myself. I didn't choose to immigrate anywhere. I didn't find financing outside of Pakistan. It all was from everything that we did started here, and we were successful at what we did here in Pakistan. We had been working in the northern areas in Gilgit-Baltistan, but particularly based out of Gilgit, running a immunization research program. And unfortunately, soon after 9/11 and the war in Afghanistan, there was a lot of throwback in the sense that many groups that we had been working with and who had supported our efforts, our research programs, were then reluctant to continue to operate in Pakistan. With years of if you will say, a funding drought in Pakistan, especially between 2003 and 2006 and 7, but actually even continuing beyond into 2010 when we saw so much violence in our country and so many explosions that other work began to be disrupted as well in centers like Karachi too, that we stuck around and we believed in what we were doing. We were mission driven, and we were mission driven to the point that it didn't matter if we had money or we didn't have money from external sources. So I can remember a personal account when I would use my salary while I continued to work with Hopkins and with other partners globally. I would use my salary to pay the salaries of our staff. And there would be days when my wife and I would have to make a call between, are we now going to pay the salaries for our staff? Are we going to fuel our car, or are we going to buy diapers for our children? One of the core reasons for IRD's success in Pakistan and in many of the other places we work in is the talent that we attract and the way we do it. And so when we recruited in Pakistan, we insisted that those people who had been trained outside, who had a track record of grants and salary packages that were what is the normal for universities or grant-based organizations in North America and Europe, that we would recruit them in Pakistan and in many of the other countries, in any of the other countries that we work in, at the same salaries. IRD stands out for having a very large number of women in senior leadership roles in the organization. In fact, I think there are many more women amongst our senior team managers and team leaders than there are men. And part of that is reflected in, I think, just, they do a fantastic job of what they do, but also in that organizationally we've been very accommodating to these young women who have trained so well, come back often to Pakistan or joined us from within organizations in Pakistan, and then aspire to have families. And in some other instances, having a child while you're working can negatively impact your career or your career prospects. We want to make sure that the young people that we take along with us, especially these young women, that's such a huge resource for us, feel that they don't have to make a choice between family and work. The kinds of things that IRD does in Pakistan to illustrate what we do in global health, from service delivery to research. So we run the Aao TB Mitao campaign. We've been able to make sure that for the first time, there's an active search for patients in the places where they live and in the places where they seek care, to really go and look for TB amongst patients and individuals in the communities. Pursukoon Zindagi allows community-based counselors who are trained to screen and then counsel individuals who might have early signs of depression and anxiety, and to refer those who may have some very troubling mental illnesses to professional care, and to do this all for free in partnership between IRD, the Indus Health Network, and other care providers in the city. And its foundation and our ability to really monitor this program is a phone app in which the counselor uses screening questions to screen out individuals and decide whether or not they actually have depression or anxiety. Personally, I have also evolved from this one aspiration of wanting to run a global health organization in Pakistan and have impact in Pakistan, to having a global health organization that's working in many more areas. But even at some point that became, well, what more can I do? As time has gone forth, I've recognized that my talent, if you will, now is best utilized in developing other young talent. Pakistan is going to be a great success story, but it's not going to be a great success story because of good speeches and because of a political party. Pakistan is going to be a great success story because of the many young people that I have seen committing their lives and careers and sacrificing for the country. To be successful in Pakistan is a success that is so far sweeter, so far more rewarding than success in any other country.